see a countdown right now.
We're counting down. Okay. Welcome, everyone. I'm Deb Tellman, and I'm here to introduce our next speaker for two reasons. First, I am the General Counsel and Corporate Secretary for Organon, a company spun out last year with a primary focus on women's health. Being immersed nearly daily in therapeutic areas of reproductive health, maternal conditions, including postpartum hemorrhage and preterm birth, has given me an even deeper understanding of how underserved women's health needs are. And as we all know, Black women are impacted most heavily. We at Organon are here today to continue listening and learning, and I invite you to visit us at our virtual booth. The second reason I'm here is perhaps more important. For me, this is personal. Like many of you, I have experienced and witnessed firsthand the unacceptable hurdles to maternal health for Black women in the United States. Personally, I've had trouble getting pregnant, staying pregnant, and maintaining my own mental health after I gave birth. Unfortunately, I suffered from uterine fibroids, which is a leading cause for infertility for Black women. And I had so much difficulty ensuring that my healthcare practitioners, including doctors and nurses, could see me and understand my medical history. And that is completely unacceptable. And that's why I'm so impressed by what the Black Maternal Health Caucus is doing to address what can only be described as a crisis. Their work is critical, it's timely, and it has the promise to benefit all of society. And they deserve all of our support. So I'm so honored to introduce Congresswoman Alma Adams, who has represented the 12th Congressional District of North Carolina since 2014. As a co-founder of the Black Maternal Health Caucus, Congresswoman Adams has been a fierce advocate for equitable maternal health. In addition to serving on the committees of financial services, education, labor, and agriculture, she founded the Congressional Bipartisan Historically Black Caucus. Representative Adams has played a key role in crafting the Omnibus Act of 2021, and we are so fortunate to have her with us today to discuss the great work by the Black Maternal Health Caucus. Please welcome Congresswoman Alma Adams.
Good morning, and thank you very much for that kind introduction. I'm Alma Adams, and I'm proud to represent North Carolina's 12th Congressional District in the United States Congress. And I'm thrilled to be with you today to talk about an issue that is personally important to me, Black maternal health and the role of policy in addressing Black maternal health disparities. I'm also happy to be here virtually in Boston, which is represented by my good friend and colleague, Representative Ayanna Pressley, who is returning the favor by coming to visit me in Charlotte later this month. I'm proud to recognize some of the other speakers here today: Massachusetts State Representative Liz Miranda, Dr. Jalicia Jolly, Dr. Judy Bigby, and of course my dear friend and co-founder, co-chair of the Black Maternal Health Caucus, Congresswoman Lauren Underwood. Let's give them a hand. Now, finally, I do want to thank Dr. Ndidi Amakaga, Amada Onu Kaga, the Julia A. Okoro Professor of Black Maternal Health at Tufts University School of Medicine. Thank you, Doctor, for not only the invitation to speak today, but also, more importantly, for the work that you're doing with the Mother Lab, the Maternal Outcomes for Translational Health Equity Research Lab. As many of you here know, the Mother Lab is the largest research lab in the United States focused on addressing and eradicating maternal inequities for Black women. And I'll have a chance to go deeper into this later, but research and data could not be more important to our efforts to close the mortality and morbidity gaps between Black and white parents. Now, when my fellow members of Congress learn that Black Americans are 3 to 4 times more likely to die in childbirth than white Americans, they pay attention, even if they're not paying attention to concepts like structural racism or implicit bias and social determinants of health. The mission of your mother lab is to address and eradicate inequities that Black women face through research and advocacy and mentorship by confronting and dismantling the system that enables and perpetuates racism for Black women who give birth. That mission reminds me some of the most important words that Dr. Martin Luther King Jr. spoke, who we lost 54 years ago this week. In 1966, at the convention of the Medical Committee for Human Rights, Dr. King said, and I quote, "Of all of the forms of inequality, injustice in healthcare is the most shocking and most inhumane." And let me repeat that: of all of the forms of inequality and injustice in healthcare, healthcare is the most shocking and the most inhumane. Healthcare is not equal in our country. It never has been. So we shouldn't be surprised when that inequity extends to mothers and their children. And as we've seen from the COVID-19 pandemic, the adage is true. When white America comes down with a cold, Black America gets pneumonia. Unfortunately, we know the truth. Maternal health in America is in crisis. And like so many crises, the maternal mortality crisis has hit Black America harder. So it's no surprise that Black women are 3 to 4 times more likely to die from preventable pregnancy related complications than non Hispanic white women, no matter their level of education or socioeconomic status. A staggering 60% of these deaths are preventable. And so when it comes to the maternal health crisis, for every mother lost, there are hundreds of near misses. And annually, approximately 50,000 women experience severe pregnancy complications, which result in serious health consequences. Even Beyonce and Serena Williams experienced the dangers of birthing while Black. That's right, y'all. Some of the richest, most powerful women in the world almost succumbed not to COVID, not to cancer, but to childbirth. And that's why the Black maternal health crisis demands urgent attention and serious action to save the lives of Black mothers, women of color, and other marginalized women across the country. And that's why I am proud to support the vision of Mother Lab and be here with you today to create a world where all Black women who want to become mothers can efficiently and comfortably receive equitable access to the same high caliber healthcare services as other women without their concerns being dismissed. A world where Black women do not face maternal health complications due to racism, homophobia, or sexism throughout their lives or throughout their pregnancy. I'm proud to talk to you about the policy solutions that we've devised to make that a reality. For me, this work began when my daughter, a Black mom herself, survived a complicated pregnancy that almost took her life. She was experiencing pain in her abdomen, and her doctor simply ignored her pain and dismissed it. Janelle was one of tens of thousands of women who experience near misses or pregnancy related complications that are traumatizing and endanger the life of the mother and or the child. And that experience made me think about what it means to be a mom. Janelle is my only daughter. She's a sister and a mother of two amazing children. And she's also a part of her community. She's a principal at her local elementary school, someone who weaves the threads of so many lives together into the fabric of her community. And I know you can tell I am a proud mom. And I thought about what happens when we pull out the threads of all of the mothers we lose every year in this country. So I knew that when I got to Congress, I had to do something. We can talk about a problem all the time, but we've got to do something about it. Now, my work on this issue started when I joined up with then Senator Kamala Harris, our vice president, and the Black Mamas Matter Alliance to introduce our annual Black Maternal Health Week resolution, something we've been doing again, that we will be doing again on Monday. And then in 2019, I joined the youngest Black woman ever elected to Congress, an amazing nurse and legislator named Lauren Underwood, to launch a congressional caucus focused solely on Black maternal health. And as the co-founders and co-chairs of the bipartisan Black Maternal Health Caucus, we developed a solution, the Momnibus. The Momnibus is a package of 12 bills to comprehensively address all aspects of the maternal mortality crisis with a focus on Black parents using reproductive justice as a guide. It is a bold, compassionate solution that unequivocally says that Black mothers matter. Then Senator Kamala Harris, Congresswoman Lauren Underwood, and I first introduced the Black Maternal Health Omnibus Act in March of 2020, 2 years ago last month, because our caucus and all of our co-sponsors wanted to make it clear to everyone that the state of maternal health in this country is a crisis and it needs solutions. So, with the support of a historic coalition of nearly 200 healthcare providers, Black mothers, policymakers, researchers, activists, and maternal health advocates, we crafted a collaborative, targeted, and timely set of policies to improve maternal health outcomes for Black, pregnant, and postpartum individuals, particularly during the COVID pandemic. The Black Maternal Health Omnibus will fill gaps in existing legislation to comprehensively address every dimension of the Black maternal health crisis in America. Throughout the process, we remained very intentional about centering the voices of Black women and ensuring that Black women-led organizations are consulted often. The Omnibus makes investments in social determinants of health, community-based organizations, the growth and diversification of perinatal workforce, improvements in data collection and quality measures, digital tools like telehealth, and innovative payment models. In addition to direct efforts to improve Black maternal health outcomes, the Omnibus focuses on high-risk populations, including women veterans, incarcerated women, and Native Americans. Of course, the same week that we introduced the Omnibus, the country went into lockdown for the first time due to the COVID-19 pandemic. So we've had to do a lot of work to keep Black maternal health as part of the conversation. And as I said, the state of maternal health in this country, it's in crisis. It's a pandemic, it's a crisis within a crisis. And tens of thousands of pregnant women have had to struggle with being pregnant or giving birth while experiencing COVID 19. Over the past 2 years, our country has suffered profound losses due to the pandemic. The value of individuals, how someone can touch an entire community, has come into clear focus. So when we reintroduced the Omnibus last year, we went from 9 bills to 12 bills because we have had to have legislation to address immunization, vaccines, as well as COVID 19. Two of these new bills in the package promote maternal vaccinations to protect the health and safety of moms and babies and, excuse me, invest in federal programs to address the unique risks for and the effects of COVID 19 during and after pregnancy. Now, I'm happy to say that the first of the 12 omnibus bills has been signed into law. I joined President Biden with the signing of the Protecting Moms Who Served Act last year, a bill that was led by Representative Underwood. Other bills in the package have passed the House or are in various stages of the legislative process. Most important is that the eligible provisions of the omnibus were included in the Build Back Better Act, which passed the House and is currently stalled in the Senate. In addition to postpartum Medicaid expansion, which I hope we'll talk about in terms of essential next steps, the omnibus provisions in Build Back Better invest in addressing social determinants of health that influence maternal health outcomes fund the community-based organizations working to improve maternal health outcomes, grow and diversify the perinatal workforce to improve maternity care, support moms with mental health conditions and substance abuse disorders, and invest in historically black colleges and universities to train culturally competent health professionals, and then finally to address the effects of COVID-19 and climate change on mothers. Well, that's a comprehensive approach to this crisis, something that we've never tried before. And this is important. It's vital. And this cannot wait because the moms whose lives we will save are important. So if you're looking for a way to get involved, call your senators. And I'm happy to say that Senator Merkley and Senator Warren have been strong supporters. And then call even more senators and tell them that the next reconciliation bill should have the omnibus in it. Additionally, let me talk about a couple of specific bills in the package. Climate change is the most important issue facing our planet, and that's why we added the Protecting Moms and Babies Against Climate Change to the Momnibus last year. That bill would establish a grant program to invest in community-based programs to mitigate exposure to extreme heat, air pollution, extreme weather disasters, and other environmental threats related to the climate crisis that pose health risks to pregnant and postpartum patients. The legislation would also provide funding to health profession schools to prepare our healthcare workforce to address climate change related risks for patients. In addition to climate change, social determinants of health disproportionately affect Black Americans, Indigenous Americans, and communities of color. And there are so many factors that can contribute to the disparities. But much of this is addressed in the Kira Johnson Act, my signature bill in the Momnibus. That's also a part of the Build Back Better Act. Kira Johnson is one of the many moms who we lost too soon. On April of 2016, she and her husband Charles arrived at the hospital for a routine C-section to deliver their little boy Langston. And after the procedure, Charles noticed blood in Kira's catheter, and he alerted doctors to it. And the doctors determined that her condition was not a priority. They waited more than 10 hours as she deteriorated, losing 3 liters of blood along the way, and she would eventually pass on early the next morning. And Langston was only 11 hours old. You know, this story hits close to home because it's so common in our community, so common, in fact, that it reminded me of my daughter's experience after she gave birth. She was in pain. Her doctors wouldn't listen. Overlooking the pain of Black women in healthcare results from implicit bias and racism, and higher amounts of implicit bias results in lower quality of care. Kira's husband, Charles, has been relentless and brave in telling her story, and that's why I was proud to name this bill after her. The Kira Johnson Act makes targeted investments in community-based organizations that are leading the charge to support moms. It provides supports for midwifery practices, for doulas, and other perinatal health workers. It includes funding to improve maternal mental health conditions, to address substance abuse disorders, and to support work to address the social determinants of mental health, of maternal health, key factors impacting well-being like economic and job stability, housing stability, climate, transportation access, access to education, food, security, community engagement, and social integration, discrimination and stress, and access to quality and affordable health care and the environment where pregnant people and mothers live and raise their children. The Kira Johnson Act also supports bias and racism training, programs and research, and the establishment of respectful maternity care compliance programs to address bias and racism and to promote accountability in maternity care settings. Specifically, it's important to me that we talk about bias in maternal care because I believe Kira's case, her care team needed this training. And that's why we need the Momnibus and why we need the Mother Lab. Unfortunately, there are other policy disparities that exacerbate the Black maternal health crisis, and it comes down to a red-blue divide. Here in Massachusetts, you expanded Medicaid, extending coverage to more parents and children. However, some states like my home state of North Carolina never expanded Medicaid, and that's left many parents at a disadvantage. And so, as we've mentioned, many of these maternal deaths and close calls are postpartum after the mom has delivered a healthy baby. So, to address the maternal health crisis, the Build Back Better Act takes the proven life saving step of expanding Medicaid for 12 months for postpartum individuals. Now, right there, you have something that's going to save lives and improve outcomes. In North Carolina, the bill will close the Medicaid coverage gap, and it will ensure as many as 4 million uninsured Americans nationwide. According to the Center for American Progress, closing the Medicaid gap could save up to 7,000 additional lives a year. And not only that, closing the Medicaid gap addresses additional social determinants of health by reducing medical debt by $2 billion dollars and preventing almost 50,000 evictions per year. It also provides a year of continuous eligibility to children enrolled in Medicaid and CHIP, and it expands access to behavioral health services. So, if it wasn't clear already, we have policy solutions to address this crisis. So, let me make this crystal clear. The Black maternal health crisis is preventable. It's preventable. And there's no excuse for inaction. We can save these lives. We can close the maternal mortality and morbidity gap between not only Black and white Americans, but also the United States and the rest of the world. We can and we must fight for a future where mothers and babies are given the tools that they need for good health. We need your help. Voice your support online. It doesn't matter what your political beliefs are either. You either have a mother, you are a mother, or you know women who are moms. So call your representatives and senators and tell them to support the Momnibus. The Momnibus will save the lives of Black women and children and improve outcomes for all mothers and parents because no one should have to lose another friend, another auntie, sister, daughter, parent, or mommy to this crisis. And when we think about how important mothers are to their communities, we should recognize that moms and birthing persons touch so many lives, even outside their immediate families. Their thread weaves into countless others. So thank you again for inviting me to speak today because your voice on this issue will make a difference. And when we raise the tide for Black women who are among the most marginalized and the most vulnerable, we ultimately raise the tide for all women. So let's work together to pass the Momnibus now because our mamas cannot wait. Thank you. God bless.
Thank you, Rep. Adams. That was amazing. We really enjoyed your presentation. I'd like to also thank Deb Tellman. Thank you so much. We've learned so much about Organon, and we will be sure to check out Organon in our expo. It was incredible to hear from you, Rep. Adams. Now we will take a 10-minute break before listening to Dr. Judy Ann Bigby discuss a physician's guide to racial disparities in women's health. Dr. Bigby's main stage session can be found in the lobby under the agenda tab. Thank you.
Thank you, Tiffany.
Thank you, Rep. Adams.